Hi, I'm Paul Horn. I'm an orthopedic hand surgeon. In this video, we're going to talk about trigger fingers. Trigger fingers, also known as stenosing flexor tenosynovitis, are a common form of tendinitis. Patients with trigger fingers have a catching or locking sensation in the finger. When it happens, their finger usually gets stuck in a bent position. Sometimes they have to manually straighten it out with the other hand. Symptoms tend to be most severe in the morning. The most common risk factor for a trigger finger is diabetes and to some degrees female gender. Let's talk about how this triggering happens. Our fingers are built like a fishing pole. The bone of the finger is represented by the rod and the tendon is the line. And in this situation, the line is tied to the eyelet at the end of the rod. The tendon sheath is represented by the eyelets. And just like these eyelets, there is a thickening in the tendon sheath, and these are called pulleys. You can see if you apply traction to the tendon, it causes the rod to bend, and that's how our fingers work. This traction is applied by the muscles in our forearms. For the finger to bend, the tendon has to be able to slide proximally, which is towards the elbow. When a trigger finger develops, there is a localized swelling or nodule in the tendon, and as the tendon tries to slide through one of the pulleys, it snaps through. Now to open the finger, the nodule has to pop back through the pulley in the other direction. There are 3 treatment options for trigger fingers. The first is nighttime splinting. This will frequently improve the symptoms, but it provides a cure in less than 50% of patients. The next option is a steroid injection. The steroid injection is given at the area where the pulley is tight. This helps decrease inflammation and loosen things up. In slightly more than 50% of patients, one steroid injection can lead to a permanent cure. In some patients, the finger will get better and then start to trigger again. Steroid injections do not work quite as well in diabetics. And one other concern in diabetics is that it can cause their blood sugar to rise, sometimes quite severely. The final treatment option is surgery. The goal of this surgery is to open up the tight area so that the tendon can travel back and forth with no locking or resistance. And to use the fishing pole analogy, we cut open the tight eyelet. Occasionally, we have to remove the swelling around the tendon as well. Most patients will make a good recovery, resuming very light activity a few days after the surgery, medium grip activities in 2 to 3 weeks, and heavy grip activity in about 6 weeks. Patients do, however, frequently tell me that the area where the surgery is done is sore for about 3 months. About 10% of patients will have a difficult recovery. For those that are still having locking symptoms or stiffness, we will often utilize physical therapy. If that is not successful, a steroid injection can be used, and occasionally a second surgery is necessary. For more information about trigger finger, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists for your care.